Growing numbers of people are affected by Alzheimer's disease, which is now the sixth leading cause of death in the United States. That's a challenge for an aging population, but also for caregivers in the family, as well as providers of health care. Also rising to the challenge are researchers at Mass General Hospital as part of its multicultural Alzheimer's prevention program. This includes work in the Harvard Aging Brain Study. To tell us about efforts to make the study more inclusive are a neuropsychologist from the hospital, Dr. Yakeel Quiroz, and a clinical research coordinator, Martha Muñiz. Thank you both for being with us.
Thank you for having us.
I want to start with the doctor because I guess right now this is about making the study more inclusive. Why is that so important?
Yeah, because traditionally, unfortunately, most of the studies that are being done in Alzheimer's disease, they have not include like minority or underrepresented groups. So everything that we know so far about the disease has been mostly for what we have learned from these studies that don't necessarily include these groups. So including individuals from like underrepresented, such as Latinos, African Americans, and other groups, actually give us more opportunity to learn how the disease actually presents in these groups, especially because, as you may know, especially the Latinos and the African Americans, they have an increased risk to develop the disease. So it's an opportunity for us to understand why they have this increased risk and also finding ways to decrease the risk or prevent the disease in the future.
Martha Muñiz, about what the study is going to try to tell us about here, I mean, because sometimes we hear that Alzheimer's disease is inherited genetically, and other times we find out it's something you can prevent. I'm confused. What's going on?
I'll try to answer as best as I can, but Dr. Quiroz might have a more specific answer. There are types of disease that present as sporadic, and there are genetic mutations that lead to people having Alzheimer's disease almost at like a 99% rate. And so what the Harvard Aging Brain Study is doing is trying to follow people who are cognitively normal and see how their brain changes in the course of 5 to 10 to 15 years. So the types of dementia that we would encounter would be the sporadic kind.
Doctor, clear that up a little bit, because as we get older, I certainly could attest to some memory problems, but some are normal and some are not. What's the difference?
Yeah, and you are totally right. Not just like as you get older, is you actually think getting older after you are 25, like after 25 you start getting memory problems. So everybody has experienced some kind of like a memory forgetfulness at some point. But what it makes it abnormal, or what is something like a sign that should be worrying us, is that how often this happens to us. Like one thing is that you forget once where you place the keys, for instance. But the other thing is like you're forgetting what you had for breakfast, or you're forgetting what you talked to your spouse or your friends the day before. Like how often these problems are happening, and also like how much they are interfering with your daily life. Like for instance, one thing is like I had to take a medication, but I'm forgetting to take the medication, which you need to take the medication. So it's something that is impacting your daily life. So it's like the frequency and also how much it's impacting your life that is becomes a problem.
Martha Muñiz, as far as what you want to see in this study, the kind of people that you're not getting so far, who are we talking about?
So right now we are currently looking and enrolling people who are Latino, Spanish-speaking individuals who have no memory concerns and are the ages of 65 to 90. We're hoping to follow these individuals for at least 5 years at the beginning of the study, and then collect data so that we can learn about where they are at baseline, and then kind of compare the results from 1 year to another within those 5 years.
What kind of a time commitment, other than the 5-year period, is involved? I mean, how much time you have to spend doing this, putting together information?
That's a great question. The first year is a lot more involved because we do collect all of the baseline kind of data points. And so it's about 5 to 6 visits the first year, and every visit is about 4.5 hours. They are typically in the morning, just because one's memory is a little bit more, or brain is a little bit more alert at that time, and so visits tend to happen at the beginning of the day.
Doctor, I'm sure one thing that you're looking for here are clues about how to prevent Alzheimer's or slow it down. What do you see so far?
So I think actually the main goal that the ultimate goal that we want to accomplish is to find ways to prevent Alzheimer's disease. Unfortunately, right now, there is no way to cure the disease. There is no treatment that actually can work for the disease. So as researchers, we are trying to pretty much trying to understand what we can do before the disease starts, so we can actually have a better chance to prevent it. So what we know so far, that is one of the main motivations of the study, we do know that people start accumulating, basically showing pathology or signs of Alzheimer's disease in their brains almost 20 years before they have any kind of memory or any kind of cognitive symptoms. So we have this window of 10 to 20 years when your brain is actually getting all these dysfunction, if you want to put it that way, before you start forgetting. So that's the part that we want to understand exactly what's happening there in those 10 years, so we can actually intervene and trying to stop it before you actually experience the symptoms.
Professor Muñiz, I imagine one other value of a study is that the more people you get involved, the more people you have talking about this problem and seeing it as something that is relevant to them, right?
Yes, correct. I think that one of the problems, or not problems, but barriers right now in terms of recruiting the Latino community is that we don't usually talk about this problem, and we do outreach events and talks so that people can start talking about this topic and not just keep it as a family kind of issue.
Right. Doctor, the other thing that's going on is that Mass General has some help for people with Alzheimer's, or at least who are living with it in their family. Anything you can tell us about that?
So there are two different services. For instance, I also work with the Psychology Assessment Center. That is one service that we have, Mass General, and the Memory Disorders Unit. That is the neurology clinic that we have. So if you experience any kind of memory impairment and your knowledge changes in your life and you need an assessment or somebody in your family needs an evaluation, you can reach out to Mass General and ask for an appointment. That's one. But if you already have somebody with the disease and you need some support, especially if you are taking care of somebody with Alzheimer's disease. So in Massachusetts and New Hampshire, we have the Alzheimer's Association, that they have a chapter in Massachusetts and New Hampshire, and you can look for the resources that they have. They have support groups, they have educational activities for the family, and even for the ones that are going through the disease.
Okay. And finally, Martha, we should imagine if people want to get involved with this study, find out more, what's the best way for them to do that?
I would encourage you to call Jairo Martinez, which is another one of our research coordinators, at 617-643-5880. Sorry.
Thank you both very much, Martha Muñiz and Dr. Yakeel.
Thank you so much for having
your
us.
time.